Hi everyone, welcome to our podcast. In this podcast, we're going to talk about diabetes. Now, diabetes is a very vast topic, but we are going to touch upon a few important aspects of diabetes. Diabetes actually affects almost 70 to 100 million people in India. The prevalence of diabetes in the urban population is around 11 to 15%, and there's a stark difference with the rural population, which has a prevalence of only 3%. Now, diabetes has been on the rise, and people are asking about what is the best way to prevent diabetes. What does pre-diabetes mean? What are the different tests used to diagnose diabetes? Is diabetes preventable, etc.? So today I'll just touch upon a couple of these questions, and maybe in the next podcast I'll touch upon the remaining. So the first thing is, what is diabetes? Diabetes is basically a chronic disease which affects how your body utilizes the food for energy. That's basically the a very layman kind of definition. It is a disease of insulin. That is the main definition of diabetes. So when I say disease of insulin, there are two types of disorders in which diabetes can present. One is your body doesn't even produce enough insulin, and the second is your body has enough insulin, but it cannot be utilized by your body adequately. Now, what is the big deal about insulin? Insulin is the hormone which actually causes the blood glucose to go into your cells and you get utilized for energy. So, if there isn't enough insulin, or if the insulin is not able to be utilized properly, then the blood glucose will rise and it is not utilized for energy adequately. So, what are the types of diabetes? There are three broad types of diabetes, and there are further sub-classifications, but the three broad types are type 1, type 2, and pregnancy related diabetes. Type 1 diabetes is a type of diabetes where the amount of insulin produced by your body is less. Type 2 is the one where there is adequate insulin, but it cannot be utilized by your body. And type 3, or gestation, not type 3, but gestational diabetes, is the diabetes which actually takes place in pregnant women. Now, what is the difference in all of these? So in type 1 and type 2, like I said, in type 1 there is no insulin, or there's very less insulin production by the body. In type 2 there is adequate insulin. So in type 1, what causes it? Type 1 diabetes is actually caused by an autoimmune disease. The exact cause is not fully clear, but an autoimmune disease is basically a disease in which your body produces antibodies against itself. That's why it's auto. Auto means self. uh, these antibodies actually have a role to play in actually destroying the insulin, or destroying the insulin receptors, or many other cells of your body which actually are involved in the processing of insulin, or for production of insulin rather. So when these insulin producing cells are destroyed, then the quantity of insulin in your body will be reduced. This usually happens at a young age, and the patient who presents with type 1 diabetes is usually young, is not overweight, has some kind of family history, and uh, presents with usually very high levels of fasting and post-lunch blood glucose. Type 2, on the other hand, is one of those things which is easily recognizable in middle age, especially men who have truncal or abdominal obesity, who have a sedentary lifestyle, who have a family history of diabetes, who have other issues such as hypertension and liver, non-alcoholic liver disease, etc. So it presents in middle-aged men who have abdominal obesity. Now, the whole point is, how do you diagnose diabetes? So, as you know, I told you it is mainly a disorder of insulin, and the insulin affects how your blood glucose will be utilized as energy in your body. So, the first test naturally to be carried out is a fasting blood glucose and a post-lunch blood glucose. The fasting blood glucose is done after 8 to 10 hours of fasting, and if your level is found to be more than 126, then it is indicative of having diabetes, but it usually should be repeated. If it's under 100, then it's normal. Anything in between is a term we call as pre-diabetes. The second type of glucose test would be a random blood glucose. And if you do a random blood glucose anytime in the day, even after lunch, and if your blood glucose level is more than 200, then you will be indicated to have diabetes. So these are the two main tests for glucose. Now the third, so these will tell you the glucose at any given point of time or any given day rather. But if your doctor or if you want to know what is your blood glucose level over the last 3 months, then what should you do? Then you should do a test called as glycosylated hemoglobin. So what this basically means is that your red blood cells in your body, which have a lifespan of about 3 months, have this molecule called hemoglobin. And the blood glucose has a tendency to bind to this hemoglobin to form this kind of hemoglobin called as glycohemoglobin. So since the RBC lifespan is 3 months, detecting the glycohemoglobin will give you a good indication of what your blood glucose has been over the last 3 months. So this will be to understand for more long-term control of your blood glucose and as a diagnostic tool as well. Anything above 6.5 is said to be diabetes. Anything below 5.7 is said to be non-diabetic. Anything in between is pre-diabetes. So these are the three broad tests for diabetes. There are many other tests to understand whether it is type 1 and type 2 diabetes, but I will not be going into that now. Now, the last thing I want to touch upon is what is pre-diabetes, since I mentioned it. Now, anything in between 100 and 126 for fasting blood glucose, anything in between 5.7 to 6.5 for glyco-HB is classified as pre-diabetes. This means you don't have diabetes, but you are not entirely normal. You have a level in between the two. Now, what is the purpose of this? The main thing is that this stage is the right stage for you to detect the glucose level being marginally elevated, and this is when it is very, very, very preventable, especially in type 2 diabetes. So you can stop yourself from actually going towards full blown diabetes by simple lifestyle modifications. It does not require any medications, or even a small amount of weight loss can reverse pre-diabetes. Just a few kgs can reverse pre-diabetes. Lifestyle changes like intermittent fasting can help play a big role. Exercise at least 3 to 4 times a week for at least half an hour a day is absolutely crucial, and adequate sleep. Just by these simple lifestyle factors and simple lifestyle modifications, pre-diabetes can definitely be reversed to a large extent, and the burden on Indian healthcare and on the families of treating complications of diabetes in the future can be reduced. So the sad part is that most people don't even know that they have pre-diabetes. So most people are completely unaware because there are absolutely no symptoms of pre-diabetes, and it can only be detected by doing a regular, at least once every few years. If you just get it checked once, you know just get your fasting blood glucose and get your glyco HB done, and just ensure that it has remained under the normal range, so you don't have to do anything else, right? And those who are pre-diabetes especially have to have very, very stringent lifestyle modifications, and that's so much better than actually progressing to diabetes, having the complications, being put on medication for a long, long time, and then it's very difficult to reverse after that. But even diabetes can be sort of reversed with lifestyle modifications, but that you need to consult a doctor. But something like pre-diabetes, you need to be detecting it early, and you need to be preventing it from going into full-blown diabetes. And yeah, so we've covered the whole basics of diabetes, what is diabetes. In the urban population, we have almost 11 to 15% of prevalence of diabetes, as opposed to rural areas of 3%. And it is basically a disease which affects your, which it deals with how your insulin is either produced or utilized in the body. There are type 1, type 2, and gestational diabetes. And the main tests for diabetes are blood glucose, random blood glucose, and also glyco-HB. The last thing I spoke about was pre-diabetes and why it is important. So that's all for today. If you have any more questions, feel free to ask us. We'll put the link below. And have a good day. Please keep this in mind. And for the next podcast, we will cover the complications of diabetes and what you can do to prevent the progression of hypertension. Thank you. Thanks for listening in. And if you have any other questions, please feel free to email us or comment on the links below. Thank you.